what are the major questions regarding these molecular profiling tests? One is, what is the accuracy in predicting the primary tumor site? What is the accuracy in identifying the tumor type? And most importantly, will site-specific therapy based on the molecular assay diagnosis improve the outcome? So now the biggest challenge in validating an unknown primary assay is, by definition, the primary cancer cannot be verified. So how do you validate these assays? So they use indirect parameters. For example, the IHC, clinical data, response to therapy, subsequent appearance of a latent primary. So the indirect parameters are used to validate these unknown primary assays. The validation studies in known tumors have been pretty encouraging. Most of all the 3 tests have a sensitivity of 80 to 90%. Validation in unknown cases also with the prediction is shown to be pretty good, with more than 90% of prediction value. What are the limitations in these tests? For example, in TO, the results are reported as one of the 15 types. The subtype will not be given in this test. Then certain tumor types, neuroendocrine, cholangiocarcinoma, mesothelioma, are not included in the panel of the test. So if your patient is off panel, then you will get a wrong result from the test. Then all 3 tests have given some common incorrect diagnosis, like from pancreas, colon, gastroesophageal, and lung cancers. And the more poorly differentiated and atypical the morphology of the tumor is, more is the diagnostic difficulty. The second generation tests are performing better than the first, but still there are some limitations. What are the strengths of these tests? I hate to say this, but they are more sensitive when they are compared with immunohistochemistry. And the overall accuracy when compared with immunohistochemistry is superior. So it's 79 versus 69, 89 versus 83. So they are performing better than immunohistochemistry, according to the current data. And do they have what about the clinical impact of these molecular tests? In one retrospective study of 107 patients, these were the findings. The site was still unspecified, or it changed from specified to unspecified, or the same specified. These were the various changes. So the overall diagnosis, it changed in 53%, and the clinical management changed in 65%.